All right, today we're going to demystify a condition that affects millions of people, heart failure. Now, I know it's a term that sounds pretty scary, right? But what does it actually mean? Well, over the next few minutes, we're going to use these slides, which are built from top medical sources, to break it all down for you. What it is, the signs to watch for, and how it's managed. Okay, so let's get right into it. When you hear those two words, heart failure, your mind probably jumps to something really final, like the heart just stops. But is that really what's going on? Well, the answer is a big, resounding no. And you know what? We need to get this major misconception out of the way right from the start. Heart failure does not mean your heart has stopped beating. It's not some sudden catastrophic event. It's actually a chronic condition that usually develops over time. Okay, so if it's not your heart just stopping, what is it then? Let's look at the actual clinical definition to really wrap our heads around what's happening inside the body. So here we go. This is the official definition from the CDC. The absolute best way to think about this is to picture your heart as a pump. With heart failure, that pump just isn't working as efficiently as it should be. It's not like the pump is totally broken. It's just struggling to get enough oxygen-rich blood out to the rest of your body to meet its needs. That's why you often see things like gears in illustrations. It's more of a mechanical problem than a complete shutdown. And this is a huge issue, believe me. In the United States alone, we're talking about nearly 6.7 million adults living with this condition. I mean, think about that. That's more people than live in some entire states. So yeah, understanding this isn't just some academic exercise. It's a really important public health issue. Okay, so when that pump starts to struggle, how does your body let you know? When the heart can't keep up with the demand, it starts sending out these little distress signals. Let's take a look at what those warning signs are. The CDC points to a few key symptoms, and you're probably going to start seeing a pattern here. A lot of them have to do with breathing and fluid retention. And that feeling of being just plain tired or weak, well, that happens because your body's organs simply aren't getting the full tank of oxygen they need to work at their best. This right here, this is the real culprit behind a lot of those symptoms. When the heart's pump gets weaker, it creates a sort of backup. Just imagine a massive traffic jam on the highway. That's what's happening in your circulatory system. And that pressure causes fluid to leak out into the surrounding tissues. This fluid buildup is what's causing many of the problems we just talked about. And this fluid backup, it can show up in a few different places. If it's in the lungs, that's what causes the coughing and that shortness of breath. If it's in your feet and ankles, you'll see noticeable swelling. And when it pulls around the liver and abdomen, it can even mess with your appetite. You might feel totally full or bloated, even if you've hardly eaten anything. Okay, let's zoom in on one really specific symptom here. It's called orthopnea. That's basically having a hard time breathing when you lie down flat. So why does that happen? Well, when you're lying down, gravity isn't helping pull that excess fluid down to your legs anymore, so more of it can back up into your lungs, and a weaker heart just can't handle that extra load. Doctors have this really clever, simple way to figure out how serious it is. They'll just ask you, hey, how many pillows are you sleeping with at night to breathe comfortably? Okay, so you've got the signs. How do doctors actually go from, this could be heart failure, to a solid diagnosis? And once they know, how do they figure out what kind of heart failure someone has? Now, this chart might look a little intimidating, but it's actually a pretty straightforward detective story. It starts with the basics, your medical history, a physical exam. Then they'll do some lab tests to look for certain markers in your blood. But the real game changer here is the echocardiogram, an ultrasound of the heart. That gives them a direct look at what's going on with the heart structure and, more importantly, its function. And one of the most critical numbers they get from that echo is something called the ejection fraction, or just EF for short. It's basically a percentage that tells us how much blood the heart's main pumping chamber, the left ventricle, is pushing out with every single beat. So, a lower number means the pump is less efficient. And that EF number is what helps us figure out which of the two main types of heart failure we're dealing with. Think of it like a weak pump versus a stiff pump. You've got HFrEF, which is basically a weak pump problem. The muscle just can't squeeze hard enough. Then you've got HFpEF, the stiff pump problem, where the muscle is too rigid to properly relax and fill up with blood between beats. And this chart here, it shows you exactly how those types connect back to the ejection fraction numbers we were just talking about. So you can see right there, HF for F, that's heart failure with a reduced ejection fraction, is 40% or less. And then on the other side, HFpF with a preserved ejection fraction is 50% or higher. And yeah, as you can see, there's that little zone right in the middle too. So here's the really important part. No matter what type it is, a diagnosis of heart failure is not the end of the story. Not at all. It's really the beginning of a new path, a journey of proactive management.
The American Heart Association breaks down the progression into these 4 stages. And what I find so fascinating about this is that the whole process starts way back at stage A. This is for people who are just at risk. They might have high blood pressure or diabetes, but no actual symptoms yet. This just shows you how much the focus has shifted to prevention, to catching things super early.
And the treatment? It's really a team effort between you and your doctor built on a few key cornerstones. You've got some powerful medicines, things like ACE inhibitors to help relax your blood vessels or beta blockers to ease the heart's workload. But just as important are the lifestyle changes, like cutting back on sodium to reduce that fluid buildup and staying active to keep the heart muscle in the best shape possible.
And that really brings us to the most hopeful and important message of all, and this comes directly from the CDC. This isn't just about surviving, it's about thriving. Taking action early and staying consistent with it, it makes a huge, tangible difference in people's lives, both in quality and in length.
So, let me just leave you with this final thought. Knowing what we know now, that heart failure is a manageable journey, not a sudden dead end, how does that change how we think about heart health? It really flips the script, doesn't it? It changes the whole story from one of fear to one of empowerment, of taking control of your health. Thanks so much for joining me for this.